It is 6:42 now, and we've been talking this morning about former President Joe Biden's diagnosis released yesterday about an aggressive form of prostate cancer. And Dr. Ravi Patel with the Comprehensive Blood and Cancer Center joins me now to talk more about this type of cancer and if there's just maybe a message on getting checked and being proactive about making sure that you're getting screened, because I know that's something that you're always talking about. Dr. Patel, thanks so much for joining me. Appreciate it. So let's talk a little bit about this diagnosis. So the president's personal office saying that President Joe Biden has been diagnosed with an aggressive form of prostate cancer that has spread to his bones. They're saying that this, because it has spread to the bones, it is no longer curable, but they're also saying that the treatment is, there's some encouraging news here, that there is treatment available for him. So as a doctor, when you're looking at this diagnosis, what do you see?
So, we look at different cancers as we've been doing before. Prostate cancer is a little bit different than, say, aggressive cancer like a small cell lung cancer, which can kill you in less than 3 months. Prostate cancer, fortunately, grows slowly. What the former president has is a fairly aggressive prostate cancer, and the aggressiveness is measured by what is called a Gleason score. Lesser the number, less aggressive. His is 9, which is almost extremely aggressive. But the treatment options are excellent because prostate cancer is driven by the male hormone. And if you use medications to suppress the male hormones, the fuel for the fire is evaporated and you can control it. So you can prolong the life.
So when doctors say it's spread to the bones, what does that mean? And why is it no longer considered curable?
Because what has happened is it's sort of the horse has left the barn and we're trying to close the door now. But what's happened is that the cancer spreads and then feeds onto the organs and the bones. And so local surgery on the prostate is not going to help a lot. But treatment which works throughout the body, which is hormonal treatment, has an excellent chance of prolonging his life. And if that does not work, there is also a kind of treatment which is called radio-targeted treatment, where you can emit small particles of radiation into the body with a radioactive substance which hits the prostate cancer cells in different parts of the body with good results. So I still think that, yes, it's stage 4, but many things can be done for it, and the life can be prolonged.
I want to talk about just couple things here. Age, obviously, the former president in his 80s here. He also has cancer in his family. We know that his son Beau passed away with glioblastoma several years ago. So when you look at genetics, when you look at age and so forth, are these all contributing factors to this diagnosis?
All of it are contributing factors. So the connection between the glioblastoma or the brain tumor and the prostate cancer, there is no connection there. But the connection is mainly in older people. Prostate cancer is a fairly common cancer diagnosis, and the older the age, the higher the risk of getting prostate cancer. But the benefit of that is that prostate cancer can be treated with relatively mild drugs than toxic ones, and can definitely prolong the former president's life.
I want to talk about lifestyle and eating habits and so forth, because I feel like every time you come on and talk about, you're always stressing the importance of this. When you're looking at preventing cancers, and I mean there are things that we can do. I mean, obviously we can't do much if it's in our genes and so forth, but with lifestyle and that we can control that for the most part. What do we need to do? How do we need to the foods that we need to incorporate in our diet and so forth? What do we need to be looking for in order to prevent some of these cancers from developing?
Very good point. You see, the thing is, people want to take it easy nowadays. Fast food, not exercising, let's have a few drinks, taking it easy. All of these are okay, but in moderation. So you can enjoy it. You can have a drink sometimes, or eat what you want. But it's a good idea to eat more fruits, veggies. If you like red meat, get farm-fed beef and use that. Fast food, not generally always good. Fish, exercising regularly, reducing alcohol intake, making sure that your weight is well maintained, and then doing your regular checkups, right? If at 45 you don't get a PSA test and time moves on and you develop a prostate cancer, the horse is out of the barn. So get your screenings done on a regular basis.
Yeah, so what is the recommendation for getting screened for prostate cancer? I know that the PSA check is kind of like one of the first steps, right?
Yes. And the PSA is a very important test. At the age of 45, it's a good idea to do the PSA test.
What if you have cancer in your family, or if someone in your family has had prostate cancer?
Yes.
Would you recommend earlier?
Yes. So that's a very important point. Prostate cancer also has what is called the BRCA gene. And if you have people at a young age in the family who have had prostate cancer, breast cancer at young age, and has been fatal, it's important for those people to be checked for the BRCA1 and 2 genes. Also, newer and newer genetic tests are coming up which can help detect different kinds of cancers. And it's very easy to do these genetic tests because you just take a sample of blood and you can get a variety of markers which tell you whether you have the risk of breast cancer, prostate cancer, colon cancer. And we have genetic counselors at CBCC who can guide you through genetic testing and then guide you through the results which we get on what to do and what not to do.
Does it all kind of just start, we're running low on time, but I got to ask you, does this all start with just talking to your primary care physician?
Important. And always your primary care physician, it's a good link to connect to all the diseases, whether it's heart disease, cancer, communicating with them, doing regular checkups with them can help.
And building a relationship with your primary care physician so that they can recommend treatment or recommend specialists if it comes to that. Dr. Patel, as always, appreciate you coming on.
Thank you so much.
All right, we'll be right back. We've got to look at your forecast next.